Hello, everyone. My name is Jason Sabai. I'm a medical officer of health here in Calgary and a member of the O'Brien Institute for Public Health and Community Health Sciences. So we've reached the final session of what I think has been a really valuable and necessary event. And we've heard compelling points about the importance of considering food's potential to promote health and to cause disease. And our speakers and panels have described a variety of challenges, successes, and opportunities to improve the nutrition landscape and create healthy food environments from a range of perspectives. So we've heard that the public health issues related to food are complex and often even wicked, where it's difficult to get agreement on the problems, never mind what the solutions are. And so we're going to need to continue to work collaboratively with everyone who understands how access to safe, adequate, and nutritious food is fundamental to individual and community health. And so I think the main point I have is that we should both congratulate everyone for all the good work being done, but also recognize there remains a real sense of urgency to use this event in particular to catalyze further action. And so in this final session, to help us do that, our final panel will now provide some reflections on what they've heard over the past 2 days, and I hope some ideas and recommendations for how we can move forward and what else needs to be done. So we have 6 panelists, 4 of whom you've heard from already, and 2 new ones, and they'll each present for 5 minutes, and then we'll have a short panel discussion, and then get into our final keynote of the evening. So first up is Kate Chidester, and is there an order preference? I can. My list had you, Kate. So So Kate is the Vice President for Advocacy, Health and Research with Heart and Stroke in Alberta, joining the organization in 2011 after 25 years in the healthcare sector as a registered nurse. At Heart and Stroke, she leads a diverse portfolio including health promotion, advocacy, research, and communications. Kate also sits on the Alberta Policy Coalition for Chronic Disease Prevention Leadership Team. Welcome, Kate.
25 years as a health services administrator, actually, so it's been a real pleasure and privilege to move into the nonprofit sector. So I was asked to reflect on our time together and what we've been learning together from a civil society lens. And so sitting in that second row there, I haven't been able to close an eye for the whole time. I've been listening so carefully and taking notes. And civil society, it's not something that you hear every day, the phrase civil society. And it actually wasn't until I studied nonprofit leadership that I learned the scope and breadth of civil society in Canada. And it includes the voluntary sector, the charitable sector, NGOs, associations. And in fact, there are 170,000 nonprofits in Canada. So 85,000 of those are charitable sector. So that's a huge amount of energy it drives and is part of our GDP. It's a large part of our employment. And most importantly, it's part of our ability to participate and make the best life possible for each other. So it's a diverse sector, but we do have commonality, and we all have very strong mission, vision, and value focus. And we're all dependent on others to support us in order to exist. And we're volunteer driven. And for example, you heard from our previous volunteer board chair for Heart and Stroke. And we are informed and guided by our researchers who act as volunteer ambassadors for Heart and Stroke. And Heart and Stroke does have 125,000 volunteers and over 4 million supporters. So volunteer It's a volunteer sector, and it's a way of the community participating in change. When Kim Kessler stated that inaction is not an option, the civil society is a prime example of people joining together to achieve a shared goal, the best possible life for people. And Eric DeLong said, to achieve, it's about putting people in the driver's seat, and civil society gives us a platform to do that. Civil society builds community and is a vehicle for every citizen to become an active participant in improving life. And Alim eloquently captured the opportunity of inclusive citizenship, where a sense of belonging is formed around our intertwined fates. I thought that was beautifully put, intertwined fates. We're not an island. We impact each other, and our decisions impact our communities and our population health. And when given an organized platform, this results in a motivated action. So the civil sector is motivated by action. Mary talked about and reminded us that it's active participants that shape policy. And Keaton noted that civil society can sometimes do what government can't. See, I was listening. Because it's important to have activated citizens out there to work in collaboration with partners, but also to not be afraid of disruption. For instance, government cannot advocate to itself, and civil society is uniquely positioned to advocate for change and to catalyze a better life for people. Many community-based nonprofits focus on what Dr. Tarasuk framed as I have to say this, it's a new word for me. Is it a new word for you? Because I hadn't heard it. A genetic intervention. Did I say that right? Agenic intervention. See, I think about this a lot because you hear different perspectives out of civil society and NGOs. Some NGOs are so beautifully positioned in the community to work with small groups of people. And we heard that out of the Alex, for instance, where having that community-based on-the-ground intervention builds community. And other organizations, say such as Heart and Stroke, have positioned themselves to really be focusing on structural intervention. Time is up. So civil society is, keep going? Uh-oh, he gave me a platform. So the Marketing to Kids Coalition is an excellent example of NGOs joining together, helping to inform policy change, working to develop position statements, evidence reviews, watershed reports, and to include a call to action in all of that, and to be able to inform and empower Canadians, and be so privileged to be able to work with champions like Senator Nancy Green-Rain. So we're an important part of the Canadian society, and we're here to partner. We're here to help others to participate, and we're very, very persistent. So we will always be here to make sure that change happens.
Like Kate, I'm sure I'm just going to be 2 minutes, but anyway, you're going to give me the 2-minute mark? Oh, okay, all right. I've had a lot of notes like this over this day, this last day and a half. I keep changing because there's just so much. And I think that's how maybe those of us that are here in the room are kind of all feeling it's like, whoa, so much amazing information. So what to do and where to start? But I think the first thing I want to say, and I think maybe this is my most important message, is I think the time is right for change. You know, I think as much as we need to keep doing research, and we've got an amazing richness of researchers in Alberta and in Canada. I'm just so thrilled that, Mary LeBay is here, and Dana, that you're here at the U of C now, and Val Tarasic, and all of that. Of course, I'm going to miss names now, sort of. It's always the problem with naming people. And Norm Campbell, you're setting it off, making the case. I think we're really blessed, and we've got good foundational support here to move forward. I think for us, and now we've got the healthy eating strategy. So if that doesn't just, open up the runway for us, I don't know what will. So I think the time is right for doing something. And I think the challenge is going to be what? And I think that's where we really want to, just building on what Kate said, sort of see what our roles are in all of this, because, people bring different roles together, and I think collectively, if we can sort of focus on a few things, we can get things done. We need policy. As much as, and the innovation speakers were fantastic. It's just great to see that. And we do need individuals to promote and to support policy, but we need more policies. I've been a dietitian for a long time, and, really, our focus has shifted so much. I think about how much of my work now is spent trying to keep people away from food. And that's kind of a weird thing. I don't remember ever thinking when I was in university that I would be trying to keep people away from food. But that's what we're doing now. We're trying to get policies so that we can make a separation, so that we don't run into every building and see a Coke and think that, every 5 minutes we should have something to eat or drink. That's weird, but it's the norm. The norm now is to always be consuming and have the right to have that, and don't take that right away from me. So we've got lots of work. But I think everybody in this room has a role to play in that. And that's what I'm hoping my takeaway for you is, to think about what you can do, because I think together we can make things happen. I just had two more things. One of them is, one of the words that came out over the course of the last day and a half has been the word courage. And, I think about New York City, that took courage. And I think about all of the different initiatives now that have happened. I think even politically for Health Canada, to develop that healthy eating strategy. I think that, there have been some acts of courage all the way along. And I think all of us need to sort of pick that up and see what we can do, because I think, together we're better. And I think what I want to just, as a reflection from a health organization, so I'm in Alberta Health Services, and we've been working on a healthy eating strategy in our health organization for many years now. And we've put a lot of effort into it to really bring our own healthcare workers and retail food providers and leaders in facilities, clinicians, to try and create that change and create that awareness and create action. And I have to tell you, it has been incredibly difficult. And I think if it's hard to do, where you would think that it's the right thing to do, why would we go into a hospital and see unhealthy food? But that's our reality, that it is a tough slog. So there's lots of barriers, and we need to be more aware of those and keep working towards trying to sort of fine-tune that and take action. But everybody can be a champion. So I'm hoping that everybody walks away from here thinking about courage, thinking about what action they can do individually but collectively to make change. Thanks.
Thanks, Sheila, for those comments and for the work that you and your team have been doing within AHS. Next, we have Kenton Delisle. To remind people, Kenton's a registered dietitian and senior policy lead in the Health and Wellness Promotion Branch of Alberta Health.
Just seeing who's left here, if there's any names I bring up if you're actually in the building so I can point at you. Might have left. The idea is that I would bring forward provincial perspective to this, but similar to what Sheila's saying, that might be going out the window. I have more questions than answers. I told you I wouldn't ask many questions, but you're going to ask them all now. And the more I learn working in this field, the more I realize the less I know, and that's happening again this weekend. Or this week, we're not on a weekend, guys, it's Monday and Tuesday. My kids live a privileged life. They're very fortunate. They have access to most any dietary pattern my wife and I model. It's their choice to eat it. They may or they may not. To Charlene's point, they do ask for my Uncle Alex's fruits, and what that is the little chews that are made with some fruit. He's convinced they are fruits, so they always want his fruits when they go back to Edson. But somehow they recognize that fruits and fruit are different, so there's something we need to study there. Their ancestors didn't have that privileged life. Their French ancestors were privileged in that they had access to food, but they didn't have a choice. They had a modeled diet ahead of them. A lot of cheese, a lot of meat. They were farmers. Their Métis ancestors. Pemmican, of course, was a big part of what they were, and we can look through our roots and see that many of them were, in fact, very heavily involved in the trade and the consumption of it. Their Eastern European ancestors, full cream, full fat, lots of sugar. And the reason why I'm bringing this forward is that they weren't wealthy, but they had access to something, and they had access to a diet. All my ancestors for the last 160 years that were born or lived 100 years before the first food guide was presented to Canada, all lived 80 to close to 100 years of age. Everybody since that time in my family, and this is a very large N of about 22 people, hasn't lived past the age of 70. So it gives me more questions when I'm thinking about food guides and policies and how it's affecting what we're doing and the confusion we have in our world. And these 2 days have been exactly that. So what does this mean? Did they have intuitive diets? I did see intuitive versus intelligent diets. Intelligent diets it's a red flag. You get very upset with that. Did they have intuitive diets, or did they have something else happening? Was it just physical activity? I can tell you that my great-grandmother, who I knew quite well, was not an active person, but she was 88 and doing very well on drinking her cream every morning. All talking about the same gene pool. So this isn't data, this isn't research, but this is a bias that I have that's coming through what I will look at. I guess the big thing that's happening is that I value public health. I really, really do. I value the role of food and nutrition in public health. I struggle with it. It's my academic profession. It's my professional role. It is part of the social determinants of health, and it can become so passionate that it consumes everything. Yet it's so far down the line in some senses. There's a lot of language the last 2 days, I almost said weekend again, about choice and even about food killing people. And it does not seem that it's to what you're saying, that it sounds like we're trying to chase away from things, and how do we get back to those things? And then in comes my involuntary mentor, and I think she may have left, Valerie Tarasek, who was, she's been an inspiration since she was a professor of mine a number of years ago. We won't say how many. And part of that is that, and not that anyone else does here, but she cares. Cares almost to a point of, even if she was wrong, you couldn't argue with it. But she's right. She's almost always right, if not always. She cares that the horse is ahead of the cart. She cares so much that she researches the hell out of it and is consumed by it on that end, almost to help us understand that it's not just about food, it's about something up ahead of the curve. So it makes me start to think of some other things and about our access and our process, and does recommending a dietary pattern, and these are questions, I'm not slamming anything, Hasan, it's questions. Does recommending Mediterranean diet, in fact, improve health outcomes? I mean, we can talk about some of the retractions of papers, but it doesn't change what's happening and what is good. Is it unaffordable? Is it unsustainable? Is it culturally insensitive? Or is it part of the answer? Is it something that can become a norm? And I don't know the answers to these things. I have biases to these things, but I don't know the answers to these things. Do we move all of our eggs into one basket of income and housing and start there? Do we move all of our efforts in food into fruit and vegetable and start there? We can't do anything that simple because it's actually too complicated, so this is why we're here with this. Will intuitive eating patterns return? And will my kids be at a conference in 20 years and talk about the turning point in consumerism of food, which we're hearing a lot of, and again, food as a right, not your right to eat, but food as a right, and please give me a takeaway, someone, for this whole conference, because it's confused me a lot. Thanks.
Thanks, Kenton, and good posing of those questions now and letting people think about them for a few minutes before we come back to them in the panel. So we've moved from civil society to a local and health authority perspective to the provincial perspective, and now two speakers from the federal perspective. And I don't think, given how many times you've been up on stage now, Hasan, that we really need an introduction to you. But welcome again, Hasan Hutchinson.
Thank you very much. I mean, first of all, I wanted to be really express how thankful I am for having the organizers for this. This has really been an incredible collection of different types of experts and people with such incredible experience and innovative practices. It's not often that we have the weekend type of approach to this where we're just learning new things all the way through. So often our meetings get kind of dry. I mean, I spent a day and a half with Kenton not that far ago, so it's nice to have this really vibrant community that has been assembled here, and I hope that there's occasion for this to continue into the future. I was sort of reflecting on what I was trying to think of were the sort of the main messages or the main principles of things that we have to do to make change. And one thing that came through from a number of places were really the importance of having strong champions. When I think of the New York City story, having Mayor Bloomberg, who was there and really forced a very different way of acting with respect to public health. I reflect with Nancy Green-Rain right in front of me, who has taken that very strong lead out of the Senate to really push something in a very different direction. I think of really the leadership of a lot of the civil society that we've had, or the Stop Marketing to Kids, and all of the partners that are behind that have really made it come along. These strong leaders, it's necessary for someone to have the courage, as somebody said, to step forward and to really try and move that bar. And I'd have to include as well, I mean, I really have to, that my Prime Minister and my ministers, how they have had the courage to sort of move in that direction with our overarching healthy eating strategy. Someone mentioned that earlier as well. Champions are important, and you don't, maybe one doesn't always realize what a difference it makes. After all of my years my 18 years in government, this last 3 has been transformational. I think it seems like you were in preparation for this time to really grab it and move and try and make a difference. It's really quite wonderful. Hard, tough, demanding, but very satisfying at the same time. I wanted to go a little bit further in terms of the second thing that I'm learning is really the importance of civil society. Of course, I've mentioned Marketing to Kids. We've got the Alberta policy. I forget what your network is called. Oh, always the long one. So you've got these NGOs that are very, very important, I think, of moving the agenda of the advocacy work, things that I can't do as a government employee, the advocacy. That's been very important, and that was key, I think, really in the build-up to going out and talking to the different political parties and getting things into their agendas. We got another round of that coming up again as well. That becomes very important. I don't know if I'm allowed to say things like that, but anyway, it is that is important, really. That type of an action that happens. It's been mentioned, the NGOs really connecting with people and really bringing in the engaged citizenship into this, and that becomes important for me as well, because my political masters, they need to see that really there is support for the actions and where we're going, and that's where NGOs and other sort of civil society is very important in that as well. The other side of civil society that we've had really good presentations about are the ones that are really on the ground and working with people and actually getting the programs up and going. And it was fascinating. Sometimes they were just 5-minute snippets that we were having in terms of presentations, but the depth of what was it, Canadian spirit, what was it, Val, you used that sort of terminology there. It was really remarkable to see that, and I've got so much to learn from people like that as well. Importance of collaboration, that came up a lot as well. And again, I mean, just go back to the groups, when the groups of NGOs are acting together, they are a force to be reckoned with, and they are really necessary. And I think of the collaboration that we are having with our provinces and our territories. 1 minute remaining. Sure, I can sort of get there. I didn't think I had anything to say. The collaboration, it really is necessary to get there. So implementation. So when I think of, back into my context of the food guide, we can do the policy and we can have these sort of basic messages for Canadians, but but that's not really the food guide. And I think this is where Kenton brought it forward when he talked about sort of what is really on the ground in Alberta. And he just went through all these examples of how this dietary guidance gets into policies and programs and standards at the level of the provinces. It gets into there as well with respect to different health professional groups, with different NGOs. It's a really important part. I can't do that myself. I can't do that. It's not just a federal thing. This is something that we all really have to be working at in a very collaborative way as we get into that implementation, so that Canadians are hearing similar messages from all of us, that we're not confusing the hell out of Canadians with our messages going forward. The one thing I wanted as well as what Kenton did to reflect on some of the messages of Val. You know, Val's my sort of, I think of her a bit as my moral authority on lots of things, and time is up. So Val, I guess really with respect to the possibility of unintended consequences, I think we have tried to take a lot of this into consideration as we develop our healthy eating strategy, and we will dive down deeper into that. But my own personal commitment, I think, for the Vals of the world is that at the federal level, at least, I'm quite involved with the developing of the food policy for Canada with the other departments, and also with the poverty reduction. I'll commit to Val that I will do my part that I can do to try and make sure that we're getting those connections between nutrition to the other parts of government that actually have the levers that can make a difference. Thank you.
Thank you, Hasan. So next, we'll welcome back up William Yan, who, to remind people, is the Director of the Bureau for Nutritional Sciences in the Food Directorate at Health Canada. Welcome, William.
Okay, so here I am speaking after Hasan again.
I left you time.
If you don't me anything that I can say now about repeating everything you said, no. But I do want to repeat one thing, though, and I also want to thank the organizers for this program the last day and a half. I think this is one of the best policy forums I've ever attended for a long, long time, so really, really impressed. Before I forget, the last session made me really, really sad that I'm still using a Health Canada-issued BlackBerry, so I can't get any airplane miles because I probably can't do the apps and can't do anything with it. I think, to me, I think the main message I heard, and I think some of you may have remembered the slide that was in our presentation last night, and you should remember it because that was the first slide that Hasan spent 7 minutes on. and if you remember the 4 pillars that is really the foundation of the healthy eating strategy, you may not have noticed that, and when you get the slide presentation later, I think it'll be available to you, you'll notice that across the bottom, there was a line and run across, and it really speaks to, that's a great strategy, but it's not going to do anything unless we partner with everybody to enable all the different pillars. Because as Hasan said, as a federal government, there's only so many things we can do. We only have the mandate to do certain things. There are a lot of things that we can't do that is really, really important for the strategy. So the whole idea of partnership as we go forward to Healthy Eating 2.0, that's where meetings like this is really, really important, that we can learn from each other. I learned so much the last 2 days. Val's talk, of course, for me, is my main file is sodium reduction and front of pack labeling, now that trans fat is done. And what she pointed out, it's not entirely new to us. We had thought about some of those issues when we were developing a policy, but the way she just put it out there and is so crystal clear that there are always going to be potential unintended consequences in every single population-based policy that we do. We try to do our best to address them up front, but that really speaks to what I think, if you would ask me what is important work going forward, in addition to finishing off all these policies and regulations that we're working on right now, equally important now is we have to come up with a framework to monitor and evaluate the effectiveness of these regulations and policies. But according to what Val told us, we also need to look at what potential unintended consequences we may have that we never thought of, because sitting at Tunney's pasture in Ottawa, we can't think of everything. And until these regulations get out there, get implemented, that's when we will find out, do we need to do some repositioning? Do we need to go back and revisit some of these regulations because there may be things that we didn't expect? An example, in the early days of the front of pack policy, back when we were still considering the stop sign, remember the stop sign that generated a lot of discussion?
It's not a stop sign, it's an octagon.
Yeah. We had a meeting request from a group that came in and talked to us, and there was a group that actually worked with people with eating disorders. And they said, have you ever considered what a stop sign on a prepackaged food mean to the client of these professionals? Because to them, the stop sign mean a totally different thing that have potentially really, really disastrous outcome. And we never thought of that. So there could be other things out there, just like the food insecurity issue that we will have to keep an eye on and make sure that we don't forget to look for any sign that may be doing anything unintentional. And then finally, my only other thought is, like Hasan said, I'm just blown away by all the local grassroots activities been going on in this area, and I'm sure across the country. And that reminds me of when I talk to my friends and somebody hear in the news that when they have an election coming up, they always show you the turnout rate for people coming to vote. And usually the federal election has the highest percentage, even though it's still not that impressive, like around maybe 50, 60% at the most. And then it goes down quite a bit in the provincial. And then when it comes to the municipal, you're down to like really low percentages, which really baffles a lot of people, because when you think about, sure, at the federal level, there are big policy, big decisions, but every day, things that happen to you as you go to work, as you take the bus, as you go do anything in your daily lives, is actually the municipal officials that really make a big difference in what you do every day. And that's what I'm when I sat through the last day and a half, that's what I was thinking. In Ottawa, we do a lot of, we get criticized for being a lot of things, but we never get criticized as working too fast or too agile or being risk takers, right? So given that, we still have to do a lot of policies, but it's really all the grassroots work that is really, really important. I think as we lead to the next mandate, as a healthy eating strategy goes forward, I think the civil society and all the work that you guys do is going to be really, really important to shape what we do going on forward. So thanks again for being part of this great meeting.
Thank you, William. So the last word goes to Dana Olstad, who you heard from earlier in a previous panel, but just to remind people in case Dana didn't get a full introduction, she's a registered dietitian and an assistant professor in the Department of Community Health Sciences at the University of Calgary. Her research focuses on the impact of policy both inside and outside the health sector and on the socioeconomic inequities in dietary behaviors and health. So working with policymakers and practitioners, Dana's research extends across the life course to study real-world programs and policies in real-life contexts. Dana.
So I'm hoping my slides are here. Oh, great. Okay. So part of what I was asked to do today was to present the Calgary Statement on Healthy Eating and Nutrition Policies. So this was Dr. Norm Campbell's initiative. He thought it would be a great idea if we could come up with something concrete from the forum. So here is the preamble to the statement, and I'm not going to read it all, but basically it summarizes some key messages from the forum that we have heard already. And on the next slide, you'll see we've listed some recommended policies. So this is really the heart of the statement, is what can we do going forward? And then at the end of the statement, it concludes by calling on all Canadians to prioritize implementation of policies that support healthy dietary patterns, basically what we have heard throughout this presentation today. So I'm just going to flip it back to the policies in case you want to scan them in a little more depth. So this is really intended to be a living document that evolves over time as evidence accumulates. And all of you, we're anticipating you should have an opportunity to comment on the statement on the Eventbrite website where you registered, but we will be sending an email out about that. So I'm bringing the academic perspective today. So our forum is nearly complete. We've drafted this statement on healthy eating and nutrition policies, and Health Canada's healthy eating strategy will now unfold over the next several years. So the question arises, where do we go from here? So I'm going to make 2 key points in summarizing what I see as future directions. So first point is that improving dietary intake at a population level and improving dietary equity are not necessarily synonymous. And I think Val articulated that very well. So policies that improve dietary intake at a population level can inadvertently widen inequities in dietary intake. So Health Canada's healthy eating strategy is a population-level approach. It's not intended to necessarily improve dietary equity. And this is not a criticism. I'm just pointing that out as a point of distinction. That's not its core aim, and nor does it need to be. But the fact that that is not its core aim just highlights the importance, as we have already discussed, of, and as Will just mentioned, we need to monitor the impact of the strategy on dietary equity. So we know there are some reasons to expect that some elements of the strategy might not harm equity. Some may even have potential to narrow these gaps, but others could potentially widen the gaps. So, like we said, we need to monitor impact over time. So my second key point is that although we focused on the role of policy in supporting healthy dietary patterns, the reality is that nutrition policies that encourage healthier choices cannot on their own transform intake. Canadians don't simply choose to eat healthfully or not. Rather, it is their life circumstances that shape their opportunities to do so. Unhealthy diets are largely a consequence of the conditions of daily life that we encounter throughout the life course, like factors associated with our childhood environments, our housing, our employment conditions, experiences of poverty, and others. So it's negative exposures to these factors, which we term the social determinants of health, that are ultimately responsible for why the diets of some are poorer relative to others. So, despite our best intentions, no amount of warning labels on unhealthy foods can compensate for job losses that leave Canadians with little choice but to purchase highly processed foods that can be mass-produced at a low price. Rearranging food groups and adding examples of culturally appropriate foods will not alter the colonialist legacy that has disrupted the traditional food systems of Indigenous Canadians. And parents cannot cook more home-prepared meals if they live in substandard, pest-infested housing lacking adequate and safe food storage and preparation facilities. So this is not at all to discount the importance of nutrition policies. I'm a dietitian. I strongly believe in them. And it's not also intending to criticize Health Canada's exceptional ongoing efforts, because they truly are exceptional and we've made huge strides recently. But my point is to illustrate the limitations of nutrition policies in the face of very real dietary constraints imposed by Canadians' life circumstances. So today we both applaud Health Canada's efforts and we want to support further action in this respect. Yet at the same time, we can't escape the reality that so much more remains to be done because individuals' opportunities to eat healthfully are tied from the very beginning of life to their life circumstances. So despite progress in nutrition policy making, nutrition policies will have limited impact if they are not also accompanied by meaningful change in policies that address the social determinants of health. And most of these lie outside of Health Canada's jurisdiction. So what is needed next is perhaps not a tax on sugar-sweetened beverages, nor a complete ban on junk food in schools, although these may be helpful, nor will additional healthcare spending solve the problem. The way forward is to partner with government ministries in charge of housing, education, taxation, and others, and to gain the support of political and community leaders for meaningful change to policies that address the social determinants of health. So I would propose that the next phase of action to improve Canadians' dietary patterns should concentrate on partnerships with those outside the health sector on bold measures to address the social determinants of health. Some of the most powerful policies will be those that improve economic security and provide access to post-secondary education regardless of ability to pay. It will also be critical to raise public and media awareness of the importance of acting on the social determinants of health, because the belief that healthy lifestyle choices can improve your health is pervasive. Ultimately, unless we address the root causes of poor diets and the conditions of daily life, progress in improving dietary patterns will be limited. Dietary inequities lead to inequities in health, and these limit Canadians' capacity to attain their full potential in life. So reducing dietary and health inequities is both a moral and health imperative in Canada.
Thank you, Dana, and thank you to all the panelists for your excellent comments and takeaways from the sessions. I heard a number of themes come up: inaction not being an option, questions about the way forward, and challenges about the what and the how, the need for policy, the need for partnerships, and the importance of looking at unintended consequences. And finally, the importance of strong champions and grassroots action. So one of the challenges, I think, with public health, as we all know, is that we in some ways share a common purpose, but in other ways we all have different lenses on what we're trying to do, different mandates, different opportunities. So I'm wondering, from the panel's perspective, now that you've heard each other's takeaways from the conference, any reactions to those other points of view that you'd like to share? Or what are you seeing, for those of you that didn't really articulate a clear sort of idea about what the immediate next steps are? We've got the statement coming out of the conference, and I think a lot of good ideas have been sparked by the discussion over the last day and a half. But any final reactions from the panel in terms of other things that we really need to use to catalyze action and address some of these challenges that have been really long-standing, but now, if this is a really key opportunity, how can we do business differently? Any takers on that big challenge?
Well, what I see up in front of me here, and I'm assuming it's up there, is almost like a charter. You know, it's almost something that we could, in our respective areas, present as a charter for municipalities. You know, I mean, that's an area that I think there's still a lot of area for or room for policy that we haven't exploited very much. And I would just like to sort of add that when I was mentioning the great researchers we've got in Alberta, I forgot two incredibly important researchers, Kim Rain, was sitting in front of me, and who, if we're looking for a champion for policy and at the municipal level, we've got a great expert right here, and Charlene Elliott, of course. But I think that there are some opportunities for this as a charter to bring it forward. It's just we need things to work around so that we can all kind of have some similar messages that we're working with, rather than going here, there, and everywhere. And so something like this, it doesn't have to be exactly this, is a great start, and I can see all the different sort of actors here as part of public health being able to use it.
A lot of us are buddies through the Alberta Policy Coalition for Chronic Disease Prevention. It's a mouthful. But a charter like this, as shown by Marketing to Kids Coalition, the Ottawa Charter, it does give a shared point of understanding, and then within our own roles, we can go out and collaborate and bring citizen participation in, so that it's not us saying, why does my child eat a Texas donut after they do their workout at the recreation center or the gym, but parents coming in and saying, hey, wait a minute, can we have something else besides this junk food in the recreation center when we're done with our great family activity? So citizen participation, a charter like this helps to be able to go and take action.
What's a Texas donut?
It's a big donut. I have never had one, wink, wink.
Yeast or cake?
Any other reactions or any other suggestions for, we've heard partnerships a number of times and collaborations, and the charter being maybe one good way of creating some new opportunity. Any other suggestions the panel has in terms of breaking down some traditional silos or overcoming obstacles that have come up either directly related to your work or generally in terms of any words people have for that?
Well, I think that the one sort of thing that's still sitting in my mind that I need to process a little more, but I think maybe there's other people that have these two thoughts sitting there too, is the great sort of presentation you gave there, Dana, about the populations who, for whom this is not achievable. So looking at, and you know, we don't have even the language, you say vulnerable populations or populations vulnerable to poor health outcomes, the marginalized. That, you know, we still have all this work to do that I think we need to do for everybody, but we still have so much work that we need to do for populations for whom this isn't going to make much difference.
Yeah, I think where I am right now is that I sort of want to work with everybody right now, but I just can't figure out how I'm going to do that. Because I've heard so many wonderful things. I want to sort of talk to the people who've been on the ground about how do we roll these things out. But at the same time, I have to get the bloody policy out first of all, and the food guide out. And then we have to work together sort of in terms of how that gets implemented and then go down from there. So certainly what things that have struck me in terms of the implementation and sort of how do we roll forward is there will be a real need, I think, that, you know, once we get out the general guidance and stuff like that, to come back again really across the country and to talk about how do we really implement this in the ways that are different across the country for different types of populations and for different socioeconomic groups as well, which we'll be able to have those sorts of discussions a bit deeper once we actually have the material to work from, sort of thing. But I see that I can learn so much about that from the people that are in the room, but I want to be in a position where we're actually talking from you at least know what's in the back of my mind of going forward. So I would really look forward to these sorts of opportunities in another, I don't know, 6 months is the right time. I don't know about December well, Calgary's fine. It's great.
Calgary in December.
I'm from Vancouver, you know. Actually, Calgary would be a nice change from Ottawa, perhaps, there. But I think that at that point, I really think in terms of implementation, Kenton, we should be thinking about how we can then bring it more real, sort of, and that we as feds can get that exposure when we can really sit down, roll up our sleeves, and work about how we march forward on that.
And I think a key point in getting other sectors to cooperate is to, for us to think through how can we make this a win-win? How can we show other sectors that if their workers eat more healthfully, they will be healthier and therefore more productive, and therefore they can accomplish their goals, and we also win by improving health at the same time.